What is a crown? In dentistry, a crown is the surface of the tooth that is covered by enamel. So when a tooth surface breaks, chips, or fractures, then an artificial dental crown will need to be placed to prevent further damage. So basically, dental crown is a cap that has been customized to be placed over the tooth that has been shaped down in order to restore its natural look, function, and shape. Hi everyone, this is Dr. Kei, your personal tooth doctor. Today we will be talking about different types of crown material available and when is a crown required. So usually, a crown will be recommended to a patient who has undergone root canal therapy, especially at the back tooth region. So root-treated tooth is often associated with a weaker physical structure. Thus, it becomes less resistant to the continuous chewing forces. So crown will then be utilized to restore the strength to the weakened tooth. So sometimes a root canal treated tooth may present with color changes like this. Its appearance can be enhanced by a porcelain or ceramic crown. So apart from the root canal treated tooth, our healthy tooth could crack or fracture due to ice chewing or nuts chewing or even grinding at night. So cracked tooth often demand a crown since the structure of tooth is already at risk. Otherwise, the crack will become worse and the tooth will need to be extracted. If you are planning to have a dental implant, then you might need a crown as well. So thinking of the implant as a replacement for the tooth that missing its roots, in this case, dental crown is replacing the missing tooth on the top. So once the dental implant is placed into the jawbone, then the crown will cover the top of the implant. So this will allow patient to chew normally. Lastly, a crown might be required for the patient who is undergoing oral rehabilitations. So for patients who have sharp, irregular, short, or sensitive surface worn down teeth typically caused by bruxism, which is grinding teeth at night, or dental erosions that are caused by regularly consuming the acidic food and drinks, then a dental crown can be used to restore its function and the shape. So the crowns can be made from a variety of different materials, but which one is the best for you? First of all, let's talk about the metal crown first. Metal crowns normally include the alloy like high gold or high platinum content or base metal alloy including nickel chromium or cobalt chromium. So they are considered very durable since they are very cheap or break. But their color is the main drawback of this option. That's why they are often used for the molars at the very back of the mouth. Because no one wants to see the metal color in the front teeth, right? Next is the Porcelain Fused Metal crowns. Let us call it PFM. So PFM actually provides patients with the best of both worlds, porcelain and metal. The porcelain part of the crown actually provides the patient with a natural looking tooth and the metal structure is ultra durable. However, the porcelain has its own disadvantage because it shows more wear and can break or chip off. Sometimes, the metal underlying the crown's porcelain can be shown through as a dark line, especially at the gum line area, and even more so if your gum recedes. However, this is still a solid option for your front or back teeth, or when a dental bridge demands more strength by the metal. Next is an all ceramic or all porcelain crown. They are easily considered as the best cosmetic choice because this dental crown provides a natural color match that is far better than any of the other materials. And they are definitely more suitable with the patients who are having any metal allergies. So they are often used in the front teeth restorations because they give the most natural look. And most importantly, without metal. The biggest drawback for this crown is that they are not as strong as the metals, but if you maintain properly, they can actually last for many years. Lastly is Zirconia Crown. Zirconia is a relatively new type of crown that has picked up the popularity in the past few years due to its great aesthetic and longevity. And the strength and durability of these materials has translated to a lower risk of chipping and breaking compared to the all ceramic and all porcelain crown. It can be used to restore the front and the back teeth as well. However, this type of material might cost a little bit more expensive. So for dentists to determine which type of crown is right for you, we will have to consider the location and the functions of your teeth, the position of your gum tissue and gum line, and how much of teeth shows when you are smiling, the colors and the shades of the surrounding teeth, and also if you are having any signs of the teeth crunching or teeth grinding, which will determine the crown material used. So you have many choices when it comes to crowns, but there is no such thing as one crown fits all. Ultimately, it will likely boil down to your specific needs. So which material would you prefer if you were to be crowned? Let me know in the comment below. And hit the like button if you like this sharing. Feel free to follow my Facebook page and Instagram channel. And don't forget to subscribe to my channel for more contents like this. So that's all for today. I will see you in the next video. Bye!